Free speech protected.
Local news, politics, business, sports, arts, music. Mike and Marty on the feed. Mike and Marty. Mike and Marty.
Good morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty. We're here on a hot summer day.
Hot summer day after a crazy storm.
After a crazy storm, we're going to be talking about some community events today and some other topics. We don't have a guest. I think I called away, but that happens. But before we continue, we want to let everyone know that this show is broadcast live from Fact TV studios in Bellows Falls. Fact TV is a community access center that provides studio space and production services free of charge to community members in southern Vermont and Keene. If you're interested in creating your own show, already producing content and wish to submit it, or want to stay informed about news and events in southern Vermont and Keene, including live coverage of local town meetings, sporting events, and community events, visit fact8.com.
And I'm going to piggyback on that and say, if you don't have the time or the energy to do your own show, but you have something that you want to promote, we can help you. That's what the feed is here for. It's here to allow people to come on, talk about something they're doing, promote something they're interested in. And sometimes it's actually a good way for somebody if they're kind of nervous about the idea of, oh my God, how do I do a show? What do I do? What's it going to be like? Is it going to be scary to be in front of the cameras? This is kind of a dipping your toe in the water kind of way to come on, get used to being in the studio, see how an actual studio show runs without the pressure of having to talk for 25 minutes and run your own show like we are experiencing today, because we're not making up things, but we had to scramble a little bit to find content.
That's true.
But after having done it for however long we've done it, it's not quite.
We have to figure that out someday.
I know we have to go back to the very first, and I do remember. I do remember that we started very informally. We didn't have a desk. We just had stools, and we definitely had a format. That certainly helps. That's a tip for if you're thinking about a show, is to have a format, follow that format, and then let it evolve. And that's kind of where we're at. Anyway, I digress.
Yes.
But I do. If you do have something you want to promote, or if you want to, again, dip your toe in the water, you have a, I don't know, maybe you weave rugs or something, and you use it, I don't know, and you want to talk about that, and you want to start a show on weaving, but you don't want to do the show, then contact, you can go through fact8.com, and Alex will shoot it to me. Contact Fact8, and we can get you lined up on the show, and you can get a taste of what it's like to be on a show. Yeah.
Or if you don't want to be on the show, we could come and tape a segment, and then we could talk about it on the show.
Yeah, so we have a lot of options here. So local events. For the second week running at the Bellows Falls Opera House, it is Despicable Me 4. Now, it's kind of hard that it's, I don't know, I watched like a portion of Despicable Me maybe one time, and it's funny, but it's amazing that it's made it to 4.
I know.
It's right up there with
Rockies. Not only did it make it to 4, but it is number 1 in the United States right now.
I know, which I was thinking about that, and I was thinking that's like, wow. Well, maybe because there's
what a franchise. The kids and
that's true. Yeah. That's true. Summer and kids like it, and I think if I remember correctly, it's got a little bit of kid humor, but it's also got some humor that's adult humor. Yeah. So I think that's a good mix, because if you got to take your kids to the movie, at least you might as well laugh too. So the classic movie is Coraline, which is the second in the anime series. This is being sponsored by Village Square Booksellers. So for the rest of the month, it will be not classic movies per se, but anime movies. Thursday night at the Bellows Falls Opera House is the Mark Arelli concert. He is bringing a string quartet, and his special guest is Phil Henry. So this is the first of this year's Ray Masuko concert series. Mm-hmm. It's produced by Raise the Roof Productions and Next Stage. So I think that Mark was a long time participant of Roots. I think he has a definite following around here. There are still tickets available, and the tickets are tiered tickets. So I think you can get a ticket for as low a price as $18, I think.
That's pretty good.
So if you're interested, that's tomorrow night. I believe doors open at 6:30 and concert starts at 7. And then I bet that Ciao Popolo is open ahead of time.
I'm sure.
So you can go in. Although I'm not sure if they're open on Thursday, so I don't want to speak out of turn. So, but anyway, I believe Wunderbar would be open. Saturday at the Flatiron, they are having a series, a once-a-month series. It's called Candidates at the Coffee House. So some of you might remember that I've spoken about the candidates do this type of talk throughout the legislator year. They go to the library, and they're there like the third Saturday of every month. So it looks like they're continuing it a little bit less formally, but at the coffee house. So this week, July 20th, it's going to be Representative Leslie Goldman and Senator Nader Hassim, and then there will be the Attorney General Charity Clark. And then on the 17th of August, there'll be Representative Michelle Boslin and Secretary of State Sarah Copeland Hanzas. I should have read the names before. I don't mean to butcher any names. On September 21st, it looks like we'll have all of the legislative parties. We'll have Michelle, we'll have Wendy Harrison, Leslie Goldman, Nader Hassim, and then we'll also have the state treasurer, Mike Pichek. On October 19th, which is kind of, I think, just before they go into session, again, it will be Michelle Boslin, Wendy Harrison, Nader, and Leslie Goldman. So this is a great opportunity. Number one, it's a great space to have it because it's a little more casual. The other one's a little more formal. It's a library. It's in a little bit of a circle. And what usually happens is everyone gets to kind of say why they're there and ask a question. I don't know if they're going to run this one the same way or if it's going to be more casual, but this is a great way to stay connected, to feel like you have a voice, and to voice your concerns in a conversational way, and not maybe a confronting way. To make it like a conversation, because there'll be other people there that might have an opinion opposite of yours. So I think it's nice that they're at least doing that. I don't know if that's what's happening in other locations in the state. I don't know.
Oh, I don't know either. That's a good question, because there's quite a controversy is not the right word. Conflict, I guess, is between the governor and the legislature. Right now,
true,
because they have a super majority that they can just basically.
If he vetoes, they can override his veto. Yeah.
And
so I think it's unique, and I think if you really do have questions, this is the way to do it. This is the way to ask, or as opposed to just kind of complaining about something. Why don't you ask? Like, why don't you ask, why did you vote for that, or what was your reasoning? And at least be willing to listen to that, and then perhaps you can state your case as to why you think maybe it's not, because ultimately they are there to represent the community. But if they don't hear the voice of the community, then then
I'm sure they hear a few voices, but
that's what I'm
not
saying, not all of the voices.
And so they think they're hearing the voices of the community, but.
So anyway, check that out. That I think it starts at 10:30, and you can get wonderful coffee at Flatiron Exchange, Flatiron Cooperative. Sorry, not Exchange. It was Flatiron.
And I think you'll find Leslie and Michelle very easy to talk to. They're so supportive of the community. If you've watched Fact TV, you can see they were in the 4th of July kazoo band. And
were they in the 4th of July kazoo band?
Beforehand, and they were really quite entertaining.
That's awesome. We had the owner on. I think we had her on right at the beginning of the year. I think she's one of the first shows. But the Little Art Supply Store.
Oh, yeah.
In downtown Bells Falls, and she had talked about that she wanted to start doing more workshops. So she's doing workshops in the month of August. Workshops for teens and adults. She's doing watercolors for beginners, pencil shading, still life drawing, watercolor landscapes, bookmaking, and drawing for beginners. So that's pretty cool.
Yeah.
She does them right in her space, and her space is in downtown Bells Falls. It's basically across from Flatiron.
Yeah,
so
right
you can't
next
miss
to Wild
it.
Goose.
Yeah. Oh, there's another good. I was trying to give a good landmark to find it. Right.
Down
right.
from just down over across from the
Right.
stair. on the same side as the stairs, but
And so our guest today was going to be the one, the only, Floyd Lawrence from Intercept.
Yeah.
And we were going to talk about what's going on with Intercept and also the fact that they're playing. We're going to do a little continuation of the Old Home Days kind of promotion because they'll be playing at Old Home Days. But unfortunately, Floyd has found himself under the weather, so he was unable to come on. He tried.
Yeah,
he really
yeah,
did.
he did.
We're hoping he can come on next week. But one of the things that Deb did mention last week was it's hard to have an event
if nobody sponsors
if
it.
nobody sponsors it. So they've come up with some sponsorship opportunities. So you could be a clock tower sponsor at a $3,000 level. That gets you like top billing and advertising and all kinds of perks. And all of this would be available on, if you went to the Chamber of Commerce website, you could find this little list of sponsorship opportunities. You could be an Arch Bridge sponsor at 1,000 plus. You could be a meeting house at 500. You could be the Square sponsor at 250 and a Great Falls sponsor at $50 plus. So there's an opportunity if somebody, again, she talked about she needs volunteers and she needs sponsors in order for this event to happen. It is, it's a full day. It's a lot of things to cover. So you can be a monetary sponsor, you could be a time sponsor, and if you go to the Greater Falls Chamber of Commerce website, I think you'll find this sponsor list, which we probably had up, but I was looking down, so I didn't see it. So the big thing that I kind of wanted to bring, did you want to talk about that upcoming concert first, because it's kind of a local event?
Well, it's a little bit late because it's tonight.
Oh.
It's Wednesday night. And so we had tried to get, as we were saying, we were always trying to get people on. And Cecilia Zabala is from Argentina, and she comes up and does a U.S. tour every year, and Peter Simoneau is sort of her manager. And tonight they're playing in Langdon at the Old Langdon Meeting House, which should be a great
neat. I didn't know there's a meeting house in
venue.
Linden.
It's a suggested donation sort of idea. But then they're moving on. And they have a tour that's going to Massachusetts and Louisiana and Austin, Texas, and Louisiana again, and ending up in Philadelphia.
Oh, okay. So this is the last.
Yeah, we're like on the beginning of the tour. So, yeah.
And what kind of music?
It's sort of, I would call it Argentinian folk music. She plays guitar. Last year they played Eugene Friesen, and her played in Next Stage, and then she did another solo performance over in Keene. She has a sort of Joan Baez like voice and plays guitar, and it's really good.
Nice. I know there's so many things to do. I
I
think it's part of why it's maybe been, well, I know there's vacations and summer's different, and I haven't had as much time to solicit guests as usual, but I think there's so many things that people are like, yeah, I don't have time.
Well, actually, I'm hoping to hook up with Peter and see if I can't get him on the show, because he does a series of Cajun performances. He has Bayou X and I can't remember the other, Back of Town, two different bands that he plays in and works with, and they do a series of Cajun concerts around.
Nice.
They played Putney last year, but they had the people dancing. It was pretty good.
There's so much. That's the thing. There's so many. It seems like lately everybody has some kind of music. Like maybe it just might be like a couple of people or a slightly smaller band, but there seems to be a good resurgence of. I mean, there's not like the big like Intercept kind of bands. There's not as many places for them to play because they're kind of big, but there's more.
Well, they played in Brattleboro just. Maybe last weekend.
Oh, at that club down there. Yeah. Well, that's like a good sized club.
Oh, okay. I haven't been there yet. That's right. It's in the old outlet.
Yeah, I haven't been there either, but I've just seen like where it's located. I think it's
yeah.
pretty good size. I'm just saying there's a lot of I think there's been I think each week they have music at the Deck on Popolo. I think even Watkins Tavern over in Walpole at the Country Club, I think they've been having some, like at least like a person, playing like maybe on a Friday night. So there's, and I'm sure there's other places. Those are just ones that come to mind.
It's the Pizza Stone and
they always have music. Yeah,
Chester has every Friday night they have a band. Usually every Friday and Saturday. We saw and I can't remember the name of the band now, but it was a
It sucks
a
when you lose your
Blind Faith
memory.
cover band.
Oh, wow.
Oh, it was like all the guitar riffs and everything. It was really good.
Oh, that's cool. Yeah, I haven't been to Pizza Stone as much as because now I go to Chapopolo.
Yeah, right.
So I got kind of out of the habit, and I forgot. Yeah, they always were a great place because they're just kind of big enough to be able to kind of get a little bit bigger. Bigger, almost like a full band in there, and of course the great
right.
pizza.
We should get Darlene on as a guest someday.
We should. I'm sure she's watching right now, as is everybody in the community, I'm sure. But if somebody is in the community, tell her that she should come on the feed. She can talk about her music production. She can talk about,
About
her
local bands and how she
Yeah.
gets. I'm amazed at the number
How
of
she
local
finds
bands
them?
she gets.
Yeah. So the one thing I kind of wanted to touch on today, because it affects everybody, is I don't know if anyone has heard about Act 167, which is, don't ask me to 100% explain it. It's like 18 pages long, and I did try to look at it to get like a synopsis of it. But if you've ever gone to look at an act that or something that's, it's not like they give you like the Cliff Notes version of it to figure out, but it does have to do with healthcare and shaping healthcare in Vermont and looking at the rural hospitals that we have, how they're functioning, how they're going to be functioning like 10 years from now. Are they sustainable? Should we change the model? I mean, they're looking at a lot. So what happened is Act 167 was brought into Congress. And there was a decision made to before any.
Now, before you go, is this a state act or a federal act?
This is a state act. Yeah. So this is just about Vermont. Vermont's trying to like, as usual, Vermont's trying to like take care of their own. They're looking at what can we do to fix what's wrong in our state.
Right.
So the idea was that before something has to happen. As we all know, healthcare is like broken, everywhere,
Yeah,
right?
yeah.
But we maybe can't fix it on a national level yet, but maybe we can start looking at the state level. And I think that was the impetus behind it,
Right.
that we had to do something or all of a sudden it's just going to come, it's going to be bad, crashingly bad. Like hospitals are going to go.
We're sitting in an example of what happened in '95 when a similar
right.
a similar climate. I mean,
Right.
it was
Right, this Rockingham Memorial Hospital no longer was Rockingham Memorial Hospital.
Right.
I mean, luckily it was able to be reconfigured to still provide
and
health care,
reused.
and that's actually a really good analogy, because I'm trying to make this understandable to the average person, because even I have a little bit more of a healthcare realm having what I do here and then being a Springfield Hospital board, but still it's like if you're not working in healthcare, it's really hard to understand the problems with it. But that's a great analogy, because it's how can we reconfigure to still keep healthcare accessible but sustainable.
right.
And so I think that's the goal. So they had a company come in, and the company did a series of community visits that were available as a Zoom meeting, so people could Zoom in on them. And I think they got pretty good response. But they did kind of center them around the towns that had hospitals. Like I think Springfield residents really knew, and Brattleboro residents really knew, and Windsor residents from Mount Ascutney really knew, but I don't know if the outlying catchment areas got as much press about these meetings and what was happening. So they didn't get, I don't know how much they got in on the initial like data entry, because they asked questions, they went to each hospital, they spoke to the administration, they spoke to the board, they spoke to the employees, so they really gathered data from all sides. And then what's happening now is they're going back to those towns that have hospitals, catchment areas, and they're presenting the data. And that's what I went to yesterday at the Springfield Library. And I meant to talk about this last week, just to inform people that they could go, but I don't know what happened last week. I think I don't remember. Anyway, I didn't get it. I didn't get it out
Air
there.
conditioners, I think.
I think it was air conditioners. Could have been. Who knows? Oh, right. I was putting in an air conditioner last week. Okay, that's why. So the community meetings are happening July 9th through August 5th. So there are still community meetings happening, just not right. Like the Springfield one is done, but there are other ones like Brattleboro will have one, the northern, each town that has a hospital. And then I believe what's going to happen is at the very end, because there's not a Zoom option for these meetings, but at the very end there will be like either a video or an overall Zoom. So you can visit healthcare-community-meetings. You can use the QR code that we have up there, or you can call 802-828-2177 to find out how, where the meetings are. Unfortunately, this slide that we have up doesn't it puts a pin in where the hospitals are, but it doesn't give the schedule. And I couldn't find the slide that had the schedule. But this is the time for people to give their input and for people to have a voice in, what might happen. So what might happen with our healthcare, what might happen to hospitals, how will hospitals stay sustainable? We had that scare of losing Springfield Hospital. And happily, Springfield Hospital hit rock bottom. They figured out what they needed to do with some strategic planning and some consulting, and they are kind of coming out of it. So the hope was that for the other hospitals that are kind of going down, going this way versus coming this way, that Springfield could be used as like a model of how do you do this? Like how do you reconfigure much like what happened here? How do we have this building?
Yeah,
we need to have
healthcare.
How do we keep it going? So instead of being the hospital, we rented to hospitals. We rented to healthcare entities, and I think that it's just one of those things that I think I would not have known about it if I wasn't kind of in the realm of work.
Well, it's an incredibly complex issue because you have basically a two-tiered health system. We have little hospitals that people really need, especially if you have something went wrong, your daughter got hit in the eye with a tennis ball, you're not going to go to Dartmouth.
Is that from experience?
Yes. You're not going to go to Dartmouth Hitchcock with that. But you need a place to go. You can't just, and there aren't family doctors anymore.
No.
So you need a small hospital. And they have to be available, and they have to be 24 hours a day. But then on the other side, you have the second other tier is the Dartmouth Hitchcock or the UVM, where they have a machine that costs more than Springfield Hospital could make in 30 years.
Yeah.
And they have that. And if you have a person who has a heart attack and they're dying and they need to get a helicopter ride up there and then get stents put in this Star Wars style lab, you need that.
Yeah, 100%. And that's, that also speaks to, I think a lot of people think that they should go to Dartmouth for everything.
Yeah.
And maybe not. Maybe you should look at, I know that Springfield, and I can only speak to Springfield, but I have a feeling that other hospitals are trying to do the same thing. They're trying to figure out, okay, who do we have for staff? Who might we need? Who could we bring in? Like Springfield Hospital has recently brought in a gynecology team. So with this gynecology team, they can now do minimally invasive fibroid surgery, which is kind of a newer thing. It's good for everybody. It's like a win-win. You don't, I think it's probably day surgeries would be my guess. You're in and out. And again, so, where's their need? Who can we have do it? And then we have to have people come and take advantage of it and realize that, okay, I can get that. I don't have to go to Dartmouth to do that. I can get that done locally, and I can probably get it done locally cheaper than Dartmouth. So keeping kind of the idea of if you want your health, it's like when we talk about shop local. If you want your downtowns, if you want that type of stuff, if you want healthcare, if you want to know that the emergency room at either Springfield or Brattleboro is open when you need it, when you have
When
that
you really
need,
yeah.
then you have to support them with other health care needs, like have your mammograms done there, your colonoscopies.
But isn't it, and I could be wrong, but part of the problem with the healthcare system in general is that
The payer model.
The payer model. They bill insurance companies for specific services, and so in order to make money, they have to generate services. And I think part of this bill might be an idea that maybe smaller hospitals need to get a general grant that would be just a bunch of money
Like
that
a general
they could
operating.
spread on their own to maybe not a bunch of money, but money that is not tied to a specific service that then they could use for preventive services, for general practitioners, and people who don't necessarily make money for the hospital in the current billing
Yeah,
model.
I'm not sure because I'm not sure that wasn't really it wasn't clear, like within the discussion was kind of like, okay, we really need to. Oops, we're getting out of time. Wow, that went quick. So anyway, we could maybe continue. Maybe we
We
can
need
get
to
somebody to
continue.
come in from the hospital and talk a little bit
about
more
this,
about it.
yeah.
But we, if you're interested at all, go online, find out about these meetings, and get, because now is the time for us to have our input and to be proactive.
Yes.
So wow, that went way too quickly.
Okay. But there you go, so community. We'll see you next week.
Local news, politics, business, sports, arts, music. Mike and